Hello, I'm Ayan Bior. COVID-19 has dominated national and international headlines for months.
And hello from me, Heidi Adams Fitzpatrick. This week, we bring you stories from across the African continent and around the world as nations and communities try to cope with the challenges and changes brought on by the COVID-19 pandemic. And we're going to show you how some are doing that with heroism and heart, and how some are doing it with humor.
And the Voice of America has been there since the beginning, bringing you the latest news and development to keep you informed. Hello, I'm Oriane Itangishaka.
This week, we bring you stories of innovation, of endurance, and of African ingenuity.
But first, VOA's health correspondent Linord Moudou has the latest development.
Thanks, Oriane. 4 months after the first case of COVID-19 was recorded in China, the number of infections underscore a sobering reality. Parts of Europe and the United States have been hit by the disease's particular cruelty. Meanwhile, the number of infections in Africa seems to be slowly ramping up. According to the Africa Centers for Disease Control and Prevention, as of May 7th, there are at least 50,000 confirmed cases of the novel coronavirus on the continent. Among all countries, South Africa, Morocco, Egypt, and Algeria have been taking the biggest hit. Experts say those numbers will likely continue to rise as some countries in sub-Saharan Africa have decided to lift some lockdown restrictions designed to slow down the spread of the outbreak. This week, some South Africans describe joy and fear as they return to work on Monday. Nigeria also joined the team to ease some lockdown measures to reduce damage to the economy. On the bright side, countries are actively seeking alternative measures to fight the disease, including rolling out large scale of tests and using technologies to spread public health messages. Meanwhile, a herbal drink launched in Madagascar as COVID Organics, claiming to prevent and treat COVID-19, has drawn attention from a number of countries. But the World Health Organization says it has no scientific basis. Back to you.
Being part of Our Voices is about more than just sitting here and talking about women's issues. It's about listening to them
And bringing their opinions to the table and making sure their voices are heard.
Because our lived experiences, our stories, and our voices will help shape the next generation.
VOA health correspondent Linord Moudou there for us. We take you to South Africa now, and as that country begins to slowly lift its lockdown and ease movement restrictions, we're hearing stories of heroism from healthcare workers at the forefront in the fight against this pandemic. Some of them have had to take on many different roles, and that's what happened to gynecologist Dr. Tahira Hassim. Marisa de Klerk brings us her story.
My patients look at me petrified. When they sit in front of me, they ask me, "Doctor, are you not afraid?" I look at them in my heart of hearts. I am so afraid. But I have to give them a reassuring face. After my day in the rooms, I then rush off to the Gift of Givers testing station at the Wits University, where I am frontline once again. I'm involved in testing patients who arrive in their cars, and these are patients that are most likely positive or have been exposed. I was once asked, "Why do you do this?" This is completely different to other mission work, and my answer would usually be to save lives. But with this, I don't know. I really don't know. All I can say is that I have to put my anxieties one side, I have to put my family aside, and we all have to do what we can. In my hospital, we only have 20 ICU beds, And from what I've read is that 80% of ventilated patients die. So my question is, should we get more ICU beds or should we get more ventilators? But then at the end of the day, are we keeping those patients alive for 10 to 20 days who are ultimately going to die and exposing our staff and using our limited resources? That's where the ethics comes in. One of my patients came to the rooms and she wanted to bring me flowers. And she said to me that it would be better to give me these crinkle paper flowers because they don't die. Fresh flowers die. And she believes that the coronavirus wouldn't kill me because those flowers that she'd give me wouldn't die. And these flowers are my beacon of hope.
From South Africa, we go to Zimbabwe, where people living with HIV/AIDS are having trouble accessing their medication as the country extends its lockdown due to COVID-19. VOA correspondent Mariama Diallo reports.
Daniso Ferry and her husband, who are HIV positive, said because of stay-at-home orders imposed by Zimbabwe's government, they are finding it challenging to refill their much-needed prescriptions.
It's difficult because there's no transport to go and collect our medication. Some of my colleagues, they do not take it within the community where they stay. They travel a short distance from the community where they usually stay.
She says they are among those at high risk of complications if they were to contract the coronavirus.
Because our immune system is down. So we are at risk, high risk to be affected with this COVID-19.
For most people, the new coronavirus causes mild or moderate symptoms such as fever and cough. For some, especially older adults and people with existing health problems, it can cause more severe illness, including pneumonia, and could lead to death. Fury says she can't afford to miss taking her meds, not even for one day.
This one is medication. Tell them eat. You know, 8 o'clock every day, for life. I don't miss any day.
According to UNAIDS, Zimbabwe has one of the highest HIV prevalence rates in sub-Saharan Africa at 12.7%, with 1.3 million people living with HIV in 2018. There has been progress because that same year, there were 38,000 new HIV infections, down from 62,000 in 2010. Mariama Diallo, VOA News.
It's very understandable, the worry that's there for people whose immune system is already compromised. Now let's leave Zimbabwe and go to Nigeria. Since coronavirus arrived in Nigeria, people's behavior and practices in Africa's most populated country have shifted to prevention. Institutions like churches and banks are handing out free sanitizers and preventative materials to help. And other practices, such as in religious institutions like laying hands on people or sharing communion, have been banned. Let's take a look.
At many churches in Nigeria's capital, worshippers are now examined and given hand gloves, sanitizers and face masks before attending services. Church authorities say these measures became necessary after Nigeria's health ministry confirmed the country's first case of coronavirus on February 28th.
The purpose of the church is to enlighten people and help people to fulfill destiny, and that includes helping people not to be vulnerable to some epidemic. So, and that's why it's important that churches should educate people on the issue of the coronavirus.
Jide Ogunshakin, who founded this Pentecostal church in Abuja, says they are limited in practices such as sharing communion cups or laying of hands during prayers.
Spiritual things are not carnal things. If the Lord expressly say lay hands on someone, why not? But if the Lord did not say so, in fact, the Bible says lay hand suddenly on no one.
Other institutions where people gather, like banks, schools and hotels, are also adopting these precautionary practices. This bank is checking the temperature of every customer who comes in and ensuring that all of them use hand sanitizer.
We have all this communication even before the virus came to Nigeria. Before it was confirmed in Nigeria, they've been sending a lot of awareness stuff to us on how to prevent it, because every day we have all kinds of people coming into the bank.
Across Africa, the rate of spread of the coronavirus remains relatively low, although cases have been recorded in at least 30 countries, including Nigeria. So far, Nigeria has not seen a single death from the virus. Authorities are hoping that if Nigerians carry out the preventive measures, that will remain the case. Timothy Obiezu for VOA News, Abuja.
After the break, comedy and COVID-19? Well, laughter might not be the best medicine to cure the coronavirus, but these comedians say it might just be the thing to get us through this pandemic. Also, we'll show you how the power of music can help Africa prevent more infections.
Before that, we want to bring your attention to VOA's COVID-19 centered virtual town halls, where doctors and researchers answer your questions about the coronavirus. Take a listen to this expert advice on this Your Voices segment.
As for fear, well, personally, I like to dare where others dread. Of course, that is the pivot of my job as a med lab scientist, adhering to standard operating procedure, though I fear risking my family. For me, sacrifice is my watchword, and I derive satisfaction in rendering service. I'm glad to be part of a great team working to change the narratives for Nigeria, Africa, and indeed the whole world as duty calls. Definitely someone must do the job. I urge colleagues to be up and doing. Let's join hands together and fight this deadly monster called COVID-19.
You remain with that sense of fear, anxiety, and also for you may be strong, but your family where you stay, your community where you live and travel. And there's also the issue of stigma. If you go into a market now and the people in the market, the supermarket know you, they kind of don't want to serve you. They kind of feel like they don't want to associate with you.
We've tried as far as possible to keep everybody safe. We're working in different teams, rotating on a weekly basis, with only 2 pharmacies running. But we still seem to get an explosion of patients on a daily basis. Trying to keep all the staff calm, as every sneeze that comes into the door and every cough is a potential risk for all of us. We've put up perspex along with the danger tape between us and the patients. We've put stickers on the floor so that people can see where they must stand. But everybody is still scared. Every time somebody coughs in the pharmacy, everybody looks around and everybody is oblivious of what's going on outside. The many people that are standing queuing, waiting to come into the pharmacy, it's not diminishing. People are there all day long, from morning to night. Hopefully this will end, and hopefully people will start realizing the dangers and keep to their quarantines, keep out of the public and keep at home to stay and keep everybody else safe.
We've got some pretty interesting things going on. I'm recording this from home because here at Voice of America, almost all of us are now working remotely in order to help slow the spread of the coronavirus.
Voice of America, upholding our mission.
We at the Voice of America are taking COVID-19 very seriously. And for that reason, we're bringing you Africa 54 live from Esther's house.
Today and every day, we're here for you. We improvise in tough times, but we report. From our closet from our laptops,
mortality rate
from our homes.
There's my little phone to do the live, and there I am. That's my little piece on how we're trying to fight the coronavirus.
As we take care of our kids,
Singing full screen yapacağım.
and our dogs wait for their walk. Our homes are the new newsroom.
We Voice of America.
대응을 위한 지침을 통해
We're all home together, but the news is still here. The show must go on. With a few stragglers along the way.
ក្នុងការពិភាក្សាអំពីមេរោគកូវីដ -19 នៅក្នុងចុងសប្តាហ៍នេះ
Yeah, literally. If you play this, you will hear the echo.
From all of us here in Washington, goodbye. I don't know, how did we do?
Voice of America, a voice for the world. Because a free press always matters.
Welcome back. You're with Our Voices. Though the coronavirus has shut down many nightclubs and comedy clubs, many comedians are still finding ways to make people laugh. VOA Mariama Diallo reports on Hollywood's Laugh Factory and the Stand Comedy Club in Edinburgh, where she reports on a Japanese comedian who stormed the world with his hit Pineapple Pen and who's back with a new message, wash your hands. Let's take a look.
Laugh Factory owner Jamie Masada started streaming live comedy shows shortly after California ordered all non-essential businesses closed.
We should not forget laughter is healing. Laughter brings people together.
When they had illegal immigrants like, follow the rules, why don't you listen to the rules?
Comedian Tehran Von Garci has been hosting live sets alongside actor Craig Robinson. He says the stream is being played in hospitals for patients infected with the coronavirus.
When I read a DM I recently got from someone in London who specifically said the last memory that they will have of their father is them watching the Laugh Factory live and laughing at Craig and myself discussing British accents. That's going to be something that sticks with me for the rest of my life.
Elsewhere, when the UK government ordered a 3-week public lockdown, the Stand Comedy Club decided to host a live-streamed show with an option for the audience to donate to the club and to the comedians. The experiment has proved a success with an audience of 100,000 tuning in to watch the first 2 shows. That's compared to their usual venue, which seats 160.
People were watching from all over the world, some people in quarantine, in isolation, people from every continent basically got in touch.
Many comedians have delved into the issue of self-isolation.
I discovered levels of tidying I didn't realise I was capable of. I genuinely spent all day yesterday clearing out cupboards, and although annoyingly I found right at the back of the linen cupboard a present I bought the kids for Christmas that I'd completely forgotten to give them. So that's a shame because they'd have loved a puppy.
Ross McClellan says doing stand-up without an audience seems odd, but there might be an advantage to it.
I feel like sometimes, right, when I walk out and people hear me speak and the way I look, they get a bit worried, you know, and I get it, I understand, it's the eyes, isn't it? I've got these big eyes in my head, you know.
And finally, the Japanese comedian who stormed the world with his nonsense Pineapple Pen hit is repurposing the 3 days after the song was released. It has racked up over 3 million views on YouTube, and the comedian's Twitter page has been flooded with videos of Japanese children laughing and joining in on his hand-washing dance. Mariama Diallo, VOA News.
Now, you've probably heard of the power and positive effects of music to educate people. But can we sing our way through this pandemic? Some say yes. VOA Salim Solomon looks at how prominent African figures are using music to spread their message.
A catchy beat, say African artists, is what's needed to help spread life-saving information about the coronavirus pandemic. Across the continent, musicians are recording songs about social distancing, spotting symptoms, and of course, washing hands. It's all part of an effort to get vital information about the disease prevention to people who might not get it otherwise. Ugandan singer and political activist Bobby Wine starts with a cautionary advice.
The bad news is that everyone is a potential victim. But the good news is that everyone is a potential solution.
Wine has teamed up with vocalist Nubian Lee for the song Coronavirus Alert. It has a simple and uplifting message.
Sensitize the masses to sanitize, keep a social distance and quarantine. Stop! The coronavirus is sweeping over mankind. Everybody must be alert. It's a global pandemic we can never take for granted. It's a matter of life we can never take for granted.
Liberian President George Weah is another prominent figure not taking the pandemic for granted. His country lived through an Ebola epidemic in 2014 and 2015 that took nearly 5,000 lives, so Weah knows the cost of an outbreak. This time, he picked up the mic, warning people that the coronavirus could take away their loved ones.
It could be your mama, your papa, brother and sister. Let's stand together to fight this deadly disease now.
In South Africa, the country on the continent hit hardest by the virus with more than 700 cases, the Ndlovu Youth Choir are trying to bust myths. The young people from the rural village of Moute in Limpopo province know that their community is particularly at risk. The choir has a simple message for the community.
Don't panic, we've got this.
Salim Solomon, VOA News, Washington.
After the break, we turn our focus to the United States and how this country, with the most COVID-19 cases in the world, struggles to find balance between keeping citizens safe and minimizing economic damage. We'll be right back.
Wash your hands with soap and water before you eat, after using the toilet, after touching anything many other people touch, like a seat on a public bus. Scrub thoroughly for 20 seconds. If you cannot wash your hands, use a hand sanitizer. Taking these steps can prevent not only coronavirus, but also colds and flu and other viruses. For more information, visit the World Health Organization's website, www.who.int.
Welcome back. You're with our voices. Without effective testing kits, nor effective medicines in the healthcare system, many countries use lockdown as the most efficient way to prevent COVID-19 from spreading. A few others believe in herd immunity. Under the pressure of cross-country protests demanding states reopen the economy, the United States seemed to find itself in limbo. It's a delicate balance between mitigating the economic damage caused by the pandemic and keeping citizens safe. U.S. President Donald Trump did not extend federal coronavirus social distancing guidelines and expressed optimism that states can relax restrictions and reopen their economy at their own pace. Still, some public health experts are concerned about potential consequences. VOA White House correspondent Patsy Widakuswara has more.
Restaurants in the U.S. state of Georgia have joined other businesses that are now allowed to serve customers after a month of lockdown.
We're doing the best we can to follow the guidelines set forth by the governor, by the president.
U.S. President Donald Trump did not extend federal social distancing guidelines that expired Thursday. He expressed optimism states can relax their own restrictions and that the ailing economy will soon rebound.
I think you're going to see economic numbers that are going to be fantastic. I believe it very strongly.
That despite Labor Department figures showing about 30 million Americans filed jobless claims since mid-March. Federal Reserve Chairman Jerome Powell has a more pessimistic outlook than the president.
The ongoing public health crisis will weigh heavily on economic activity, employment, and inflation in the near term and poses considerable risks to the economic outlook over the medium term.
The White House in mid-April released guidelines for states to reopen their economies. Called gating requirements, it's based on a decline in documented coronavirus cases and hospital preparedness, among other factors.
You have about 30 states that are now
either in the process of reopening or thinking about it. Probably only a handful actually even meet the initial White House gating requirements there.
President Trump said his administration is working with the private sector to accelerate vaccine development. The nation's top health expert says a drug called remdesivir is showing promise.
The mortality rate trended towards being better in the sense of less deaths in the remdesivir group. 8% versus 11% in the placebo group.
But for right now, before any area or state rushes to reopen, the think tank Bipartisan Policy Center wants communities to keep evaluating their own progress to protect the public's health.
Declining cases or the percentage of positive tests in a sustained manner for at least a couple of weeks. The second is increased testing capacity to not only just test individuals who have symptoms, but also vulnerable populations. A third is having a healthcare system that is under capacity. And fourth is, again, having a public health system that can do the important detective work and contact tracing.
Even in states technically still under lockdown, many flout policies to stay indoors, including beachgoers in Southern California. Patsy Widakuswara, VOA News.
And that is our show this week. Remember, you can find more news and information on the VOA website. You can also connect with us on social media. Our handle is @VOA Our Voices. You can also find us on WhatsApp. That number is right there on your screen. Send us your questions and your comments. We would love to hear from you.
And the Voice of America has been there since the beginning, bringing you the latest news and development and future stories to keep you informed. We'll bring you more stories of innovation and survival, as well as African ingenuity.
The virus may have changed our societies, but it's also brought us together. That's all from us today. On behalf of the Voice of America and on behalf of my co-hosts, thanks for watching. Good day.